Welcome back to American Medicine Today. I'm Kimberly Bonati. I'd like to welcome to the show John Montgomery from Tennessee. Thank you for joining us, John.
Uh, Thank you for having me.
Now, can you tell us how you came to be in pain and kind of describe what type of pain it was?
Initially, I was in the Army. Been living with my entire life. Stopped me, but this recent incident, I fell off my truck at work, and basically it incapacitated me.
Wow. And I do want to thank you for your military service. So, you said you fell off a truck and it really left you incapacitated. Where on your body were you actually feeling the pain?
Most of it was my lower back, sciatic, running up and down my leg.
Ugh.
It was bad.
And so, what did you try to do to relieve that pain?
I could do nothing. There was nothing I could do. I just dealt with it.
So, were you still able to do activities and just push through it?
Well, I've pretty much done it my whole life, but
Wow.
this time it actually stopped me. I mean, I fell in February, and then I was released to go back to work in April, and I went back to work for 5 weeks. And because I hadn't been doing what I'm used to doing, it wasn't getting aggravated. I just basically felt like it was the pain that I've been used to living with. But as I got back to work, it started getting worse and worse and worse, and got to the point to where I couldn't even lift my leg off of my fuel pedal to push my brake pedal. It
Oh
just
my
got to the point
gosh,
where,
John.
it never stopped me before, but this time it did.
Wow. So, that's really just the body kind of saying, John, it's time to take care of me. So, at that point, what did you do? Did you try any conservative type treatments?
Basically went to the doctor, and he told me, he took MRIs and said, well, you might need back surgery. You might need hip surgery. We don't know.
So, he didn't know?
He didn't know. He had no clue.
Wow.
They did the MRIs. He couldn't figure anything out. He referred me to Vanderbilt University, and they pretty much said the same thing. And I went for a second opinion where I had a myelogram done, which was extremely painful. And that doctor turned around and said the same thing. I can't find any problem.
So, all of these doctors can see that you can barely function, and they're all telling you, gee, we don't know why. We don't see anything. And by all intents and purposes, you should be fine.
Correct.
So, where do you turn at that point?
At that point, I had no idea where to turn. I mean, I was told from the disability company to sign up for Social Security disability. And it was like, I can't live like this. And I didn't know where to turn. I was at the end of my ropes because they basically said, we can't help you.
I'm sorry to hear that. So tell me, you live in Tennessee. How was it that you made the trip all the way down to Hudson, Florida, about 40 minutes north of Tampa?
My father-in-law saw your advertisement, I guess.
Consistently reflect 98.75% patient satisfaction. 75,000 procedures have been...
It's like, what do I got to lose? So I called and they said, do you have images? I had an MRI and a myelogram. It's like, send them over. I think that was a Friday. I sent them over. And then the following Tuesday, Dr. Bonati himself called me and started talking. I tried to tell him what was going on, and he told me, shut up. It's like, excuse me. It's like, don't tell me what's wrong with you. I will tell you what's wrong with you. And he went through a list, and he hit the nail on the head on every single thing that was going on with my body. And then he turned around and said, I can help you.
So tell us about your evaluation day. I mean, after suffering for so long and all these doctors kind of telling you that there was nothing wrong, what was it like to actually hear the doctor tell you that you could be helped?
I mean, I've been waiting to hear that my whole life. But at this point in time, I was regretting going to sleep because I was going to sleep. I was in pain. I was waking up. I was in pain. I needed to do something. And the whole entire time, 4 months to be exact, I was waiting for the other doctors to fix me.
Wow.
And then they turned around, we can't fix you.
Right.
And when Dr. Bonati said, I can fix you, it was like, okay, when can we do this? It's like, when do you want to do it? It's like, next week, come on down.
So tell us about your evaluation day. I mean, after suffering for so long and other doctors telling you really that nothing was wrong, what was it actually like to hear someone new and actually understood your pain?
I was excited. I was looking forward to it.
And
I wasn't looking forward to surgery, but I was also looking not being in pain anymore.
You have your Bonati spine procedures finished now. What was it like in the recovery room when you're actually taking your first steps post-surgery?
I was sore, but it was from the incision. But the the first surgery pretty much took away the pain I had in my leg from the sciatica.
All right.
It was pretty much all gone.
Your actual steps post-op, though, what was that like to walk and not have that excruciating pain that brought you into the Bonati Spine Institute?
It was awesome. Yeah. Well, I mean, I did post op on Wednesday, and they said walk, and I walked. We walked out. We walked on the beach, me and my wife, and
Mhm.
and I did a couple thousand steps, and I felt good. I felt fantastic.
Now, I hear you got back to an active lifestyle pretty quickly after returning to Tennessee. Can you tell us about that?
Well, the day we got back, which was the day before Thanksgiving, I actually went hunting.
Hunting.
And and prior to that, I'd tried going out and I took a little walk. And
Uh-huh.
when I was in so much pain. I was down for like 2 days. I was hurting so bad.
Aw.
And 3 days after my surgery, I went hunting and took the same walk, and I was great.
Well, that's the miraculous nature of the Bonati spine procedures. Thank you, John, for sharing your story of recovery with us.
You're welcome.
Thanks,
Take
John.
great
And-
care. Now, if you want to find out if you're a candidate for the exclusive Bonati spine procedures, visit askbonati.com. And if you would like to see more stories just like John's, you can search the Bonati Spine Institute on YouTube.